This is the first in a series of videos on glaucoma training. Module 1. Why is detecting and treating glaucoma important? The learning objectives for this module are to understand why glaucoma is a problem that needs addressed, to know the facts and statistics around glaucoma, to empathise with glaucoma patients' feelings, to recognise the need to counsel patients with glaucoma, and to recognise everyone's responsibility around improving glaucoma care. There are several different types of the common eye disease we call glaucoma. In each type, the optic nerve, which connects the eye to the brain, becomes damaged and the sufferer loses their vision. The most common type is called open-angle glaucoma. Open-angle glaucoma is sometimes called the thief of sight because it steals people's eyesight without pain or discomfort, and vision loss is so gradual that people often do not notice it. We will mention other types of glaucoma during the glaucoma training modules, but we will be concentrating on open-angle glaucoma, as it is common and patients are unaware of having it until they have lost much of their vision. So when we say glaucoma throughout this training, we mean open-angle glaucoma. Open-angle glaucoma cannot be cured. It requires ongoing treatment for the remainder of a patient's life. Blindness from it also cannot be reversed, but it can be prevented if the disease is diagnosed early and treated. Effectively addressing glaucoma therefore requires the careful involvement of many different people, including health workers, the patient, non-clinical staff, and health planners. As eye care practitioners, we must do more than merely diagnose and treat people with glaucoma. We must gain the trust of patients and show them that we are there to help. It is important to understand the fears people have about surgery, which is sometimes the most certain way to preserve the sight of people with glaucoma. Many people dread the words surgery or operation, but will also struggle to afford eye drops or come to the eye clinic for follow-up visits. Unless we address their fears and misconceptions, they will certainly lose their sight. Some facts about open-angle glaucoma. Glaucoma is the most common cause of irreversible blindness. Based on prevalence studies, it is estimated that globally 79.6 million individuals had glaucoma in 2020. This number is likely to increase to 111.8 million individuals in 2040. At least half of these with glaucoma are unaware that they are affected. In some developing countries, 90% of glaucoma is undetected. In many cases, glaucoma may be asymptomatic, and it is estimated that more than 11 million individuals were bilaterally blind due to glaucoma in 2020, which is around 13% of the cases. In most cases, blindness can be prevented with appropriate control and treatment. Relative to population size, there are up to 4 times more cases of open-angle glaucoma in people of African origin than in other ethnic groups. Patients themselves and their carers are extremely important in the successful management of glaucoma, whether by surgery or medical treatment. They must come to the clinic for surgery and follow-up, and instill any eye medication needed. Patients also can help to prevent blindness from glaucoma in their loved ones by encouraging their first-degree relatives, parents, siblings and children, to come for an eye examination. It can be very helpful to find out what the community knows and thinks about glaucoma. This knowledge enables us to provide appropriate information to patients and their families, and ensures that we are effective in raising the public's awareness of the condition. Glaucoma is very similar to other non-communicable diseases, such as high blood pressure and diabetes, where the disease causes damage before there are any signs or symptoms to observe. We may be able to learn a lot from our colleagues about how they manage these conditions and how we can apply their experience to the management of glaucoma. For example, patients who are struggling to accept a diagnosis of glaucoma would find tapping into the strengths of a glaucoma patient support group to be of great help. For patients on medical treatment, time is needed to explain the crucial role patients or their carers have to play, as well as all the practicalities. So explain what happens when eye drops are not used, how and when to instill eye drops, where to get eye drops, where to keep them, and how much they cost, how to recognize when vision is deteriorating, and how to recognize fake drugs. People who have been diagnosed with glaucoma will have a lot of new information to absorb, and they may struggle to come to terms with being told that they may lose their sight, or more frequently, with the fact that the sight they have already lost cannot be restored. Patients also have different ways of dealing emotionally with a diagnosis of glaucoma. They may postpone taking any action, go into denial, or may seek help from other providers, some of whom may have harmful practices. We must give our patients enough of our time, and if our own time is limited, then we should arrange for them to speak with a trained counsellor. This will be someone who understands the condition and the treatments available, but who also knows how to listen to patients and help them make the best decisions for their eye health and future vision. We should do our best to understand how our patients feel and what they may be experiencing. We can use these insights to help them deal with the despair and despondency of having vision loss. For example, by emphasizing the residual vision which can be enhanced with the help of low vision services and/or community-based rehabilitation, rather than the loss which cannot be retrieved. Strong links with low vision services and community-based rehabilitation is therefore an essential component of glaucoma care. Although the medical and surgical treatment of glaucoma is the responsibility of ophthalmic staff at the tertiary or secondary level, people working in primary health care have a major role to play in the counselling of patients and their relatives who are also at risk. After diagnosis, they can help to provide support to patients regarding low vision services and the use of medications. Mid-level personnel with good training and supervision can help by taking regular measurements, such as intraocular pressure and visual fields, capturing and transferring information and images, and making timely referral of patients according to agreed clinical guidelines and protocols. Optometrists and optometric technicians have a special role to play. Routine checks for glaucoma will help with early diagnosis and referral. They could provide regular monitoring of people who are at risk of developing glaucoma. Non-clinical eye care staff also have a very important role to play in glaucoma care, and it is important that they are well informed. Receptionists are the first contact for people with glaucoma. They may have more time to talk with patients. They also speak the same kind of non-medical language as patients, and may therefore have a greater influence over the opinions of patients. Records staff must understand why it is so important to have well-kept and accurate records, as these will help to reveal the trend in the progression of glaucoma. Technicians are responsible for maintaining and servicing eye care equipment essential to the provision of glaucoma care. Poorly calibrated or non-functioning tonometers can result in inaccurate test results, which means that the patients will receive the wrong care. Tonometers must be calibrated regularly, and every user must know how to do this. A surgical instrument set that is not complete or well maintained can also contribute to poor surgical outcomes. We should encourage entrepreneurial attempts to make technology affordable, including image capture and transfer for diagnosis as well as laser treatment. Eventually, there will be technology to help with early diagnosis of glaucoma, which will also allow patients to self-diagnose, keep accurate records, and track disease progression. We need pharmacists who are willing to stock the right glaucoma drugs and know where to procure them. If pharmacists have comprehensive knowledge of what impact glaucoma has on patients, families, and society, they can advocate for and prioritize glaucoma medications for inclusion in essential drugs packages. Health planners may find that a strategic approach similar to that used for non-communicable diseases such as diabetes and hypertension may have benefits. This might include conducting surveys, making drugs affordable, and advocating for the inclusion of glaucoma in policies relating to non-communicable diseases and universal coverage. When glaucoma is truly made everyone's business, it will be possible to achieve control and reduce its devastating impact. Fear of job loss and the perceived stigma of vision loss contributes to the secrecy of some glaucoma patients. We must engage with employers and encourage them to help to reduce the stress for people with glaucoma. They can do so by providing insurance coverage for health checks and treatment, and by offering some assurance of continued employment, even if a change of roles is necessary to suit the person's reduced vision. Understanding a few simple facts about glaucoma will help community members and also non-clinical members of the eye care team to work in tune with the clinical staff and to understand what patients are facing. In particular, it is useful for them to understand how glaucoma differs from cataract. There are different types of glaucoma, so diagnosis and treatment is more difficult than for cataract. People with glaucoma are often unaware that they have the condition until significant vision has been lost. Vision loss from glaucoma cannot be reversed. Treatment aims to stop or slow the visual loss. Because vision lost from glaucoma cannot be restored, early detection is critical. Accurate diagnosis of glaucoma in the early stages can be difficult, even for highly trained ophthalmologists. Treatment may involve surgery or eye drops. Eye drops, if used, will have to be used regularly and for the remainder of the patient's life. Surgery will not restore vision. It stops or slows down the further loss of vision. By comparison to cataract surgery, patients need much closer follow-up after glaucoma surgery. Intraocular pressure, IOP, in the patient record refers to the pressure in the eye. IOP is important in diagnosis and management of glaucoma, as the aim of treatment is to lower the IOP. Glaucoma is a chronic condition, like high blood pressure or diabetes. Patients will need care for the rest of their lives, and keeping accurate records is vital. Here are some thoughts from the patient's perspective. This is Aruna's story. When I was first diagnosed, it hit me hard. I thought, oh no, it cannot happen to me. I was really quite distressed. I didn't know anything about glaucoma. All I knew was that I could go blind. I'm quite an independent person, and I would hate to be dependent on anyone. The thought was very scary. I do have follow-up appointments at the hospital, but I think they should be more frequent than they are. Even at the eye clinic, the staff write down notes, but don't tell me the information. My daughter, who is a doctor, helped me to find out about glaucoma and the importance of keeping up with my treatment. Having the right information made me feel much better and gives me the independence to manage my condition well. And John's story. I was diagnosed with ocular hypertension, which then developed into glaucoma. The environment of the hospital and the way health professionals communicate with patients can affect our ability to live with the condition. Staff should be open, explain what is going on and how medicines work, so that it takes the worry out of the situation. One of the great difficulties with glaucoma is that I have no idea how it is progressing. I have to rely on what I am told. So I want to ask questions to understand. After all, if I wasn't worried, I wouldn't ask. I visit 2 hospitals for visual fields tests. In one, the test is done with no explanation, while in the other, the nurse will take time to go through the results. This is much better. It means I can see the difference for myself and can ask sensible questions of my ophthalmologist during my appointment. That concludes the module on why is detecting and treating glaucoma important. Write down any questions you have about this module and be sure to have them answered. Ask yourself, what am I going to do as a result of this learning? Check that you have achieved the learning outcomes for this module. To understand why glaucoma is a problem that needs addressed, to know the facts and statistics around glaucoma, to empathise with glaucoma patients' feelings, to recognise the need to counsel patients with glaucoma and to recognise everyone's responsibility around improving glaucoma care.